Good morning, everybody. Welcome to our webinar of today. I introduce myself. My name is Luisa Pagano, and I'm the Secretariat Coordinator at the Pancreatic Cancer Europe. I will lead you through this webinar today. And before showing you the program of today, I would like to mention you a few rules. First of all, I ask you to mute your microphone so that the background noise are not interfering with the presentations and the speeches. Second, if you want to share comments, asking questions during the presentations, you can use the chat. We will take care of them and answer your questions. And for your information, we are recording the webinar so that the video recording will be then available on our YouTube channels and on our website as part of a webinar report. For the program of today, the topic, as you know, is mastering a patient's care and giving information on health, physical activities and pancreatic cancer. And the webinar is co-organized with two other institutions, is European Pancreatic Club and the European Oncology Nursing Society. We are very happy of these cooperations, and we hope that this will continue also for other initiatives. So we will have then a welcome note addressed by Afrodita Panetes and Fernanda Conceição. We will have then a testimony from a patient and a survivor that used physical activity to support the treatment of the disease, Radek Orczewski from Poland. You will have then time to pose him questions and to go in depth in his story if you want. And after that, we will have two keynote speeches, one from Professor Cindy Noisilet. She will introduce us to the benefit of physical activity for pancreatic cancer patients. And the second one from Eva Esther Molina Beltran, giving practical informations and practical suggestions on how to use physical activity in a patient's treatment. After this, we will have again question time. And before coming to the conclusions of the webinar, we made by Alfredo Carrato, he's a PC chair of the board of directors. We will show you the launch of the trailer launching a video campaign on physical activities and pancreatic cancer. So that's the program of today. I give now the floor to Afrodita and Fernanda for their welcome message. Thank you, Afrodita. You are the first.
Hello, everyone. Thank you. I'm Afrodita Panetescu from the European Pancreatic Club. I'm so glad to take part in this event on physical activity and pancreatic cancer. I would first like to thank our friends from Pancreatic Cancer Europe for taking the initiative and for developing the idea for this webinar together with the speakers, and from the European Oncology Nursing Society for their support. I think this collaboration highlights the value of bringing together shared objectives across organizations. For EPC, it is an opportunity to support continuous education for healthcare professionals and to advocate for the highest quality care for patients affected by pancreatic cancer. This event highlights the role of physical activity in supporting patients with pancreatic cancer and aims to guide better care decisions every day. For healthcare professionals, this is an opportunity to deepen our understanding of integrative care approaches. I think today's session will not only share helpful information, but will also encourage teamwork and the shared goal of better care for everyone affected by pancreatic cancer. Thank you everyone for joining. I'm looking forward to the speakers' presentations. And next we have Fernanda Conceição from the European Oncology Nursing Society.
Hi, thank you so much. In my name and EONS name, I'm representing the European Oncology Nursing Society community and our president-elect, Elena. It is very thrilling for us to be part of this kind of initiatives. I am involved in caring for pancreatic cancer patients during these treatments, surgical treatment. It's such an important issue to discuss the physical activity and how can we be active promoters and help patients to acquire this knowledge, the importance, how to apply. We nurses are on the full spectrum of all of this disease, from the prevention, from the treatment to survivorship. And it seems simple, but it's not a simple information to give. It's almost a brand new pillar of healthcare. So it was very important for us to be involved in this webinar and to start to promote education to healthcare professionals, to nurses, to actually advocate better for patients. Thank you so much for the invitation, and I will give the word to Luisa again. Thank you so much in name of the EONS. It was a pleasure.
Thank you. Thank you very much, Fernanda. Thank you very much, Afrodita. It's now time to come to Radek and to listen to his very, very impressive story. We have a presentation managed by us and then a short video to show to you. Okay, Radek, it's time for you to introduce yourself and to talk about your story. You are still muted. Okay, I think now it's fine. Yes, great.
Hello. Hi, everybody. I am Radek Korzęski from Poland. I live in Poland, and now I am doing my vacation with my family in Spain. So I am now in Ronda in Spain. And after this webinar, I will join my wife to see all attraction of this beautiful country. Okay, let me introduce my story. Story with pancreatic cancer. Now I am a very happy man with full efficiency, but over 5 years ago, I had very bad diagnosis. Before diagnosis, I had a happy family. I was a sportsman. I won over 100 tournaments in tennis and table tennis, of course, as amateur. And also I was complete abstinent. But in 2019, I had a diagnosis, pancreatic cancer. First symptoms was high glycemia, decreased efficiency of my body. I had weight loss and post-eating gastric problems. And after this, I go to the hospital and I had a primary surgery procedure. Jaundice, endoscopic stenting. I had also diabetic symptoms. And after consultation with my surgeon, with Professor Stanisław Hać, I decided to take a second surgery procedure. total pancreotomy. In Valentine's Day at 2020, I had total pancreotomy. But after this, I had many problems in the hospital. I had jaundice infection, and I had a third surgery procedure and 4 surgery procedure. I had weight loss over 25 kilograms, and I had almost I was died in hospital. But after these problems, I discharged from hospital in March, last days of March 2020. And it was a beginning of my new life, in fact. After 2 or 3 months, I had first tennis trainings, and I had a recommendation of for insulin pump. I gained my weight over 5 kilograms. So I decided to start work as salesman in a Ford showroom, and started to playing table tennis and tennis workouts. I stabilized also glycemia and returned to standard diet. This is my stage in hospital. I was in a very bad condition. In the left corner photo is my this is my professor with his favorite knife. Next, next, please. Okay, this is my second stage in my timeline. After 2 or 3 months starting my work, I had another problems with after gastroscopy, and I had anastomosis, ulcer detection to do, and because of stress at work and irregular eating, I had also anemia. And I started to work at Toyota showroom because of calmer organization and less stress organization. I had also Medtronic insulin pump with cesium sensor. And at the end of the 2021, I returned to amateur tennis league after surgery. I also canoeing with Professor Hatch over 24 kilometers, and I had a bicycle trip over 50 kilometers with my wife and my colleague from Sweden, my gastroenterologist. During the last 2-3 years, I started restriction diet, elimination of reflux and heartburn, and elimination. I started eliminating flat lens and reduction of glucose spikes. I changed the nature of my work, and from sales to engineer, I started work as IT engineer in 2022. And after 3 years, now I have a full efficiency, minor restrictions. I had many successes in sport, in balanced life. For example, in next slide is my daily plan. I started my day at 5:50. After 5 minutes, I had a motivation live with Club 5:55 and started breakfast. Now at work about 8 a.m. I started. I usually start work at 7:30 and work as IT manager. About 2 p.m. I had a dinner, and after this at 3:30 I had tennis trainings usually, and these trainings ends about 8 p.m. Even 10 p.m. Here you have my hexagon of happiness with 6 balanced parts of my life: relations, health, work, finance, personal development, and personal time. And I usually ask myself from 0 to 10 where I am in this separate parts of my life, and now is balanced hexagon. I had some challenges during my last 2 years. I told you about the stress at work, problems with my enzymes because of availability of enzymes in Poland and other countries. I had gastrointestinal problems, bleeding from anastomosis. I had to change of diet and the medications. Also, we had COVID in 2-3 years ago. And also I changed 5 times my insulin pump because of damages of this type of pump. Some solutions about these challenges: more physical exercise, of course, change of my job, change of my diet. I had an introduction of new drugs. I changed of type of insulin for faster, and also I prepared a list of my dreams to check it and realize. And I prepared a list of my family dreams. Some successes in relation. I was a winner in tennis tour. I was a winner in a table tennis tournament. I played in the second table tennis league. I started to working with my daughter and wife, and also I improving physical fitness. For my efficiency, it was one of the most important thing, improving physical fitness. Also, I had a 70-kilometer trip on bike, and I had an adoption of the herd, 2 children from Nepal. And also I supporting patients on Facebook forums. And this is my history of my last 3 years. Swimming pool. It was one of the most challenged thing because of my insulin pump and my injections. I tried to be prepared with my body to swim with the swimming pool. I was very happy to do it. Also, my physical activity with table tennis, with table tennis league, with my children, with my students in tennis court. I am active tennis trainer also. And now, last of the thing. Please play the video from my professor Tadeusz Hać.
My name is Stanisław Hać. I was operating Radek Korzęcki because of IPMN main duct type before malignant transplantation, and it's extraordinary patient and extraordinary medical. My name is Stanisław Hać. I was operating Radek Korzęcki because of IPMN main duct type before malignant transplantation, and it's extraordinary patient and extraordinary medical case from my point of view. He is prepared to present his history on the medical congress, and I am very proud of him. And he gave me two questions. First was, what was the largest challenge in his treatment, and what decide about successful final outcome? And the first question, my answer is the largest challenge was the decision and surgery of reconnection of digestive tract after emergency disconnection because of deficiency. It was the largest challenge for me, and it was a nervous situation, and few days I was waiting about the result, and it was definitely, from my point of view, the largest challenge. And the second question, what decide about successful outcome? It's completely outside of medical staff and medical equipment. I think the most important is his motivation and his conscience. It's extraordinary man, and this power from his internal power decides to overcome all these disadvantages during his treatment, and actual motivation for the living and for sport, for activity, and for everything he's doing now. Definitely, it's his powerful mind. Thank you. Goodbye.
Thank you very much, Radek.
This is the end of my presentation.
Yes, thank you. Thank you very much. It's been very, very interesting. It is now time for you to ask questions, 5 minutes. You can either write in the chat or asking for the floor by raising hands. Okay, so we have the first one. Iga, you can talk.
Yes, thank you. It's not a question, just a comment or even information, because I know Radek, we are Polish, so we know each other, and somehow Radek connected with Europa Poland, so we started to cooperate, and he became the ambassador of the foundation. And now, Radek, let me send you the greatest thank you, and now you are officially ambassador of the Europa Poland Foundation. I will send you the certificate and the sign. So Radek is really very powerful person, and he also wants to share his knowledge with other patients, which is really very great. And he's, as you can see, his story is really very powerful. So thank you, Radek, for sharing it. And I am really very happy that you are here today. Thank you.
Yes, thank you, Iga. Thank you. So, other questions? Yes, Fernanda, you can go.
I have to have this question. Such an amazing story. Thank you so much for sharing. During probably very difficult days after surgery and the complications, and when you were admitted, what strategies could be done to recover faster in terms of physical activity when you probably are very debilitated? In your experience.
During the hospital, I was very weak, but the most important thing was to stay with my sister. My sister was going to me every day at 7-8 a.m. and started me and pushing me out from how to say in English, from my room, and started me for all day, cleaning me, brushing me. So it was very, very important. But very important also was to keep my dreams. To be with my family, be with my daughters, be with my wife, and be with my passions in tennis and table tennis. I had supporting time from my colleagues, from my friends, from my co-workers, from showroom. It was very, very important. And during my days in the hospital, I sold some cars also. So it was very, very tricky. But no, I was almost died in hospital. I had 3, 5, 10 hours before dying.
Thank you so much.
Yes, thank you, Radek. We have time for one more question from the audience, if any. No? Okay. Then thank you very much, Radek, for sharing your story with us. We move now to the next presentation. Is Professor Cindy Noiselet with us. She is the head, she's the Department of Medical Oncology at the Curie Institute Saint-Claude in France. She is certified in hepatogastroenterology and in oncology, and she is a lead member of the Prodige PDAC and BTC working group for clinical trials and national PI of several multi-center trials in the field. She led the APAC-AP trial of adapted physical activity in patients with advanced DAC in 2023, and she supported the drafting of the French guidelines for nutrition and physical activities in GI cancer. She's president of the Associations for Biliary Tract Cancer and Disease and chair of the EORTC Pancreatic Cancer Task Force. Thank you, Cindy, for being with us today.
Thank you, Luisa. Thank you to everyone. Good afternoon. Can you see my slides now? Yes, it's working?
Yes.
Perfect.
Yes,
Thank
it's
you.
working.
So yes, for this presentation, my aim was to share with you the basic knowledge you need to have when you talk about physical activity with patients or with people who have pancreatic cancer and their relatives. And so for this, I thought that it could be nice to guide you through the very nice booklet about adapted physical activity, on which Esther, who is going to talk right after me, has worked a lot in order to provide this important information for healthcare professionals as well as patients. So here are my disclosures. So first, I think it's very important to share with the patients the right definition of terms. And the first two important message is that the best way to fight fatigue is not to rest and to limit the time where the patient is sitting or lying, because it will make the fatigue worse. And so I think it's the first point that is very important to share with the patient and the families during the consultation. And the second point is that physical activity is not sport, or is not only sport, because when we talk to patients and we tell them it's very important for you to do physical activity, some of them may be afraid that we are talking about sport. So with all that it implies in terms of competition, rules, all the rigidity of the way you practice sport. And so the important message is that physical activity is much more than sport. It's all the situations in the daily life where you are active, but not only during sporting activity, also where you are going from one point to another, walking or cycling, when you are doing gardening, when you are dancing. So the very important thing is to find activities where you have pleasure, because what we would like you to do is to do the physical activity over a long period of time and not just for 1 or 2 times during the disease. And the third important message is that this physical activity will be adapted to the treatment, to the symptoms related to the disease. And so, of course, we will not ask someone who is 40 years old and very sporty to do the same thing as someone who is 70 years old with other comorbidities. So I think these are the very important messages that we have to share in terms of introduction. Then the center of the action of physical activity is on the muscle, but we will see in the next slide that it's not just the muscle. There are also other effects of physical activity, but it's important to understand that during the cancer, there are some modification of the muscles due to the inflammation, due to the factors that are released by the tumor. And so we have muscle dysfunction related to pancreatic cancer. And so one way of physical activity to help in this disease is to limit muscle dysfunction by acting on the muscle fibers. And so why there is muscle dysfunction? It's related both to the tumor, but also to the treatment the patients are receiving, and particularly chemotherapy can play as well in the muscle waste that we observe in the patient. So it's something multifactorial, but physical activity will help on these different aspects. In terms of definition, there is also the importance of distinguishing malnutrition, sarcopenia, and cachexia, which are overlapping entities, but not completely synonymous. And so sarcopenia is the term that we use to describe the loss of muscle mass and muscle function related to the disease and the treatment. Initially, sarcopenia was something in the field of geriatric, and it has been translated into the field of oncology to talk about these muscle issues that we have during cancer. But patients who are malnourished are very often sarcopenic. And during pancreatic cancer, it's more than 2/3 of patients that are malnourished at diagnosis, and even more who suffer from sarcopenia. So I think these are also important definitions. And Esther will talk about the way we have to assess both the muscle composition, the muscle mass, the muscle function in patients in our daily practice, but that's the parameters that will be taken into account by physical activity professionals to adjust the program. Then, as I told you, physical activity has plenty of other benefits. The first one that is well demonstrated in the literature is its role to fight against fatigue, as I said before, because in patients with cancer, we have a vicious cycle between the decrease in physical activity leading to a decrease in cardiorespiratory function and capacity of the organism to do exercise. And so the less we move, the more the fatigue increase, and we need to do physical activity to break this cycle. And we know that there is no pharmacologic intervention that is efficient against fatigue. The only way to reduce fatigue is by doing physical exercise. So I think it's also an important message for practice to share with your patients. And the idea is that physical activity, beyond its effect on the general condition and on the muscle, has also other benefits and different parameters, including metabolism, including immunity, including the microbiota. And so it's developing also beyond the field of supportive care as an integrated part of the treatment for patients in order to increase the efficacy of other treatment. Another important point is that you can't talk about physical activity without talking about nutrition and vice versa. It's very important to always put both of them together, because in order to have the best effect on the patient malnutrition or sarcopenia, you need to combine physical activity with nutrition. So for nutrition, we know that we have different tools. We have dietetic counseling, we have oral nutritional support, artificial nutritional support. It's important to define the calorie and the protein goal and to make sure that the patient covers his needs with the food intake or the nutrition intervention. It's important also to take into consideration that doing physical activity will induce an increase in the energy needs. And so the patient will need to have more protein, more calories. And so it should not be combined with exclusion regimen, with fasting, for example, because it will be a risk for the patient to increase the malnutrition. I remind you that during cancer treatment, there is no evidence at all that practices such as exclusion of glucose or fasting can bring a positive effect in patients. So it's not recommended to do that. It can increase malnutrition and toxicity of treatment. So then, that said, how do we put that in practice? What it is in the reality, how we advise patients to do physical activity. It's important to know that physical activity for each patient is defined based on some parameters called the FIT-VP. So for frequency, intensity, time, progression, volume, and type of exercise. So when we want to describe the physical activity we want the patient to have, we need to take a time on each of these parameters. So first, the important thing, Esther will develop that further, is that we combine two types of activity. Aerobic activities in order to improve the cardiorespiratory fitness and so to decrease the fatigue linked to the deconditioning cycle that I described before, and also strengthening exercise in order to improve the muscle mass and function. And then we have to adjust for each patient the type of exercise, the intensity of the exercise, and the progression. For every patient, the important is that we start low and we try to get to the the right level of intensity in terms of exercise. An important thing also to have in mind is how a patient can know about the intensity of the exercise is doing. And for that, there are easy parameters regarding breathing and talking. When you can do the exercise, but you need to breathe more heavily, but you are still able to talk, the intensity of the exercise is moderate. It's the minimal intensity if you want to improve the cardiorespiratory fitness. But if you do an exercise where you are short of breath and you can't talk anymore, it's vigorous intensity. It's something that is more efficient to improve the physical condition, but it is also associated with potential risk. So you should be monitored by a professional when you go into this intensity of exercise. Then we have also in the booklet the counsel about the professional that you should meet before starting the physical activity. So regarding the medical evaluation, the important point is that a healthcare professional should rule out a risk for a potential cardiac event in a patient. So if we have a patient who is at high cardiovascular risk, it's needed to have a consultation with a cardiologist to have a green light before starting a physical activity program. And then there is the question of being accompanied for this practice by physical activity specialists. Unfortunately, these specialists are not available in all countries. But the idea is that these professionals have a specific formation, a specific training in order to assess patients with medical issues and to design personalized programs for these patients. But for example, in France, they do exist, but they are not reimbursed by the national health system. So it's also an issue about the availability, the accessibility of these professionals. One of the other important message is about involving the caregivers and the family and the friends in this practice of physical activity, because I said to be efficient, the patient needs to be regular in the practice and to do it all over the course of the disease. And so we need to have motivation. And when you involved people you like and you practice with them, it's a very good way to stay motivated and also to give another dimension to physical activity. It's not just doing exercise for the performance, for doing exercise. It's also because it's a social experience. It's something that brings you pleasure, not only by the physical experience, but also by the setting where you do that. And so it's something very important to put that into another context, another dimension of sharing good moments with friends. It should be something for the quality of life first. And so finally, the important message that we have in the booklet is to have this information and discussion with the the healthcare professional for all patients about the benefit of physical activity, reassuring the patient and the family about the safety of doing physical activity. There is no risk. We have plenty of trials showing that there is no risk. So as we said, we have to be careful in patients at high cardiovascular risk, but otherwise it's something that is progressive, that is with an adapted intensity, so it's safe. It's important to reduce the time where we are not active and to keep on being as much active as possible during the disease and between the different chemotherapy treatments. it's important to have this progressivity into practice. You will not decide to go from 0 to running a marathon from the first months of starting physical activity. So that's why there is this idea of adapting clearly the volume and the intensity according to the previous condition, the symptoms, the treatment, etc. Having this idea of being regular in the practice, the motivation, and so not making this like something you need to do as a work, but you need to do that for pleasure and to feel better both in your mind and in your body, and be supported by the family. But also I think that as healthcare professional, we have also a very important role in helping patients in their motivation to practice this by showing them the benefits they can derive from physical activity. So with that, I think I shared with you the basics, let's say, for this physical activity and why patients should do physical activity. And in the next minutes, Esther will show you how we do that in practice.
Thank you very much, Cindy, for introducing us to this very important topic. So question will be at the end of the second presentation. So now is the time for Esther to show the presentation. But first of all, a few words about her experience. She is a nurse since 2012, and she's an advanced practice nurse in gastrointestinal oncology at Curie Institute since 2021. She has a university degree in pain management, hypnosis and clinical nutrition and metabolism, with a master in advanced practice nursing. So thank you, Esther, for being with us today. The floor is yours.
Okay. It's good for you? You say my presentation?
Okay.
Yes.
Okay. So good afternoon, everyone. I'm honored to be a part of this webinar, and I thank both Pancreatic Cancer Europe and the European Oncology Nursing Society for the invitation. So today I'll be sharing with you some insight on how we can practically integrate physical activity into the care of pancreatic cancer patients with a focus on both advanced and localized disease. So here my disclosure. So the first step before prescribing physical activity program is a comprehensive assessment. So this includes body composition, often through with bioelectrical impedance, DEXA scan or CT scan at the L3 level to evaluate muscle mass. It's true that some machines are hard to find in current practice, like DEXA or the impedancemetry, but all our patients have a CT scan for cancer monitoring, so we can use it to make the muscle tissue assessment and the follow-up. After we have we also assess muscle function through tests like the hand grip, sit-to stand, the 6-minute walking test, or the get up and go test. And these tests can be made by physical activity professor, physiotherapists, but also by other healthcare professional form to do the test as nurse. And we found now the guidelines with all the cutoff of these tests to evaluate muscular function and sarcopenia for our patients. Finally, we have to consider global factors as comorbidities, symptoms, motivation, and socioeconomic factors. We need to understand each patient's lifestyle and what barrier they might face to tailor a safe and effective program. Also, we have to understand patient motivation to assess facilitator element to physical activity and socioeconomic setting, because practice facilities are not the same between patients. For example, it will not be the same for a young patient in working age with children or an elderly retired patient. So now we assess other patient physical condition, we pass to the practical implementation. We know that we are guided by a strong recommendation from the SMO, the ASCO, and the SPEN. And all of these societies support integrate physical activity into cancer care as early as possible. Is at the same time as the oncological pathway, all the societies recommend to evaluate nutritional and metabolic pathway periodically and make the intervention adapt to the patient condition and adapt to the different assessment. In the case of advanced pancreatic cancer, the medical treatment is based on chemotherapy. In this case, the APACAP study conducted by Professor Nazier and based on physical activity session in addition of usual care shows that this kind of intervention improves global health status and quality of life, especially functioning score and relief from symptoms such as pain, insomnia, appetite loss, and constipation. So programs in this case should aim to reduce sedentarity, as Professor Nazier said. So we aim to reduce sedentary times. We have to target a moderate intensity. We must adapt it to chemotherapy-induced fatigue and involve caregivers to promote long-term engagement. For in localized pancreatic cancer, where surgery is the keystone of the treatment combined with chemotherapy, rehabilitation must be the best intervention we can offer for patients. Rehabilitation is a multimodal pathway to combine physical activity, nutritional, and psychological support. For pancreatic cancer patients, studies show that this kind of structured physical activity improves treatment tolerance, clinical outcomes, and physical function. But data in this localization is limited because in this study we can observe an important rate of patients who decline participation due to the psychical impact of the illness, or they are not interested. So we can answer ourselves about general knowledge about the positive impacts of physical activity intervention for this patient, but also we have to take account of all the difficulties who the patient can be confront in his life. So to summarize, for localized patient, the main objective is to enhance patient physical condition, to improve treatment tolerance and outcomes. And sessions can range from moderate to intense intensity, and this will be carried out over a shorter and target period. So physical activity cannot be considered isolated, as Professor Nazier said earlier. Nutritional support is critical, and it's important to help patients to achieve the goal of 30 kilocalories per kilo per day and 1.5 grams of protein per kilo per day. Pancreatic cancer patients are the most malnourished patients in oncology, and they have a complex pathway who involves a lot of healthcare professionals and caregivers during a long period. So to implement this kind of pathway is important to, this is our cancer pathway. So it's important to align efforts across the care team. And this includes assessing local resources. And for this point, it seems essential to rely on nurses to help to all the care team for this intervention. Nurses are the professionals who provide a holistic view of the patient throughout all the care pathway. To the success also of this intervention, it's also important to involve all healthcare professionals and ensure coordination between hospital and community settings. And finally, a systematic nutritional assessment at the same time of physical condition assessment is essential for ensure the success of this intervention and the adaptation of this intervention to the patient condition. And the program evaluation is essential. Also, we should routinely gather feedback from both patient and caregivers and be ready to adapt intervention and our program when challenges arise. So in conclusion, physical activity is a high impact intervention that can significantly improve quality of life and outcomes for pancreatic cancer patients, whether they are undergoing chemotherapy or preparing themselves for surgery. Nurse, as a healthcare provider, play a crucial role in assessing, educating, and supporting patients through these programs. Integrate physical activity and nutritional support into our holistic care plans. We not only treat the disease, we also empower patients or persons, finally. So thank you all for your attention.
Thank you,
That's
Esther,
all
for
for me.
introducing us into this path, very much needed. We understand the urgency to apply the plan in the care of pancreatic cancer patients. So here is time for questions, for answering questions. So we can follow the procedures are before. You can raise a hand or just ask Cindy and Esther for clarifications or sharing experiences. So we have a few nurses also on the panel, so it will be interesting to hear also your stories in sharing physical activities with patients. Don't be shy.
Okay, I could start asking Esther and Cindy about their experience in physical activity with pancreatic cancer patients. I have read the paper at the Journal of NCCN, and I know it very well. And it really helped the patients. Their quality of life increased very much, and the final results were encouraging. So I would like you to comment on the people who want to drop out of the program, and how can you convince them of getting in again? So this is one thing that I am sure that you have to face, and how can you solve that?
Thank you, Alfredo. I think that we have more of a problem of patients who don't want to try enter the program. than patients who drop out during the physical activity. Of course, when we have a disease progression and the general status degrade, they are not fit enough to continue. But most patients, Esther, will talk under your control, but I think that, I will say that 80 to 90% of patients, they truly feel the benefits of physical activity. And once they have started, they realize that it's good for them and they want to continue. And we have very few patients saying, yes, I've tried, but no, it's not for me. I don't like it. I think most of them, when they have the right professional to accompany them and to adapt the program and to bring them motivation, they really like practicing. I think that this issue, it's more when they don't have a human going with them through the physical activity program. I mean, when the patients are just directed toward videos to look at, and the doctor will say, look at these videos on YouTube to practice your exercise. This is very bad for the motivation. I think we need to have social interaction, human interaction, in order to get involved. But when you have this kind of organization, I think most of people, they don't drop out from the program.
Thank you, Cindy. This is a very relevant message.
And we see it when we make the physical activity assessment with the 6-minute walking test. Sometimes patients start and say, I'm not going to be capable to make it today. And when they finally do it, and finally feel by themselves that they are better, only after 6-minute walking, this is they change their mind about physical activity. And also, in addition, who Cindy said, I think that it's important to empower patients to take their responsibility for their own health. Most of time during my consultation, I tell them we can do a lot of things for you in terms of medication, but we cannot do physical activity for you. That this is the only thing that you can do for you, for yourself. So I think that it's important to say this message for them.
Yeah. Thank you, Esther. Rohini, you have a question? Yes, please.
Yes, can you hear me?
Yes, very well.
Thank you. Thank you for this amazing presentation. And I just wanted to ask, for me, after Whipple surgery, it was, I used to do like, not intensive exercising, but yoga all my life, and also some other cross fitness exercises. And I had to start all over after my Whipple surgery. I couldn't really do the asanas that I could before. And even now, what I find challenging is that when I ask a physiotherapist or a kine about why these poses I'm not able to, like, I don't feel comfortable, or to what extent can I go in these asanas, because it can be intensive as well. I don't get responses as such. So I'm still struggling to find who should I go to really for who may be able to guide me and who understands, about, who has some knowledge of, let's say, cholangiocarcinoma or pancreatic cancer and Whipple surgery. Yeah.
That's a very good point that you raised, because indeed, physical activity professional is a healthcare work that is just growing now. We are in the early years of this job. And so, as you clearly said, it's not the same to have pancreatic cancer after surgery or to have breast cancer after surgery. You're not in the same state of mind. You don't have the same physical limitation following the surgery, etc. And so for them to develop an expertise, they need to get familiar with the different type of of cancers. And so that's why I think we truly need to have them during their training to work in a close interaction with medical departments to learn exactly what is the trajectory of the patient, what are the consequences of the surgery, what can be done or not. So by talking with the surgeons, etc., in order to have more experience and expertise to give advice then to patients, as you said. And so I think it's difficult for them because for most of them, they just have theoretical basis about physical activity, but they don't have a deep practice. It's the same as for medical doctors. You need to see many patients in order to be familiar with a disease. And so I think it's more maybe by talking to the MDs, the doctors who care about you. Maybe they know a physiotherapist or a physical activity professional with who they are used to work, and so they have learned exactly how to manage this kind of situation. But it's true that if you go and see a physical activity professional who is specialized in breast cancer, it will not be, or in obesity, because they are also not all focused on cancer. Some of them are doing other medical conditions. It might not be appropriate to have the best advice. So I unfortunately, I don't have an answer to your questions. So about who could be the best to help you, Esther. I don't know what is your feeling about that, but we are also with Esther struggling to find the right professionals when we don't ask people working in our department as physical activity professional. It's difficult to know outside of the hospital who can be the professional we can make the patient go and ask outside of the hospital.
Yes, I completely agree. We have less literature and data on pancreatic cancer patients, so we build it together and we work a lot of in a little network between us. We search together and we answer questions together, but there are a lot of things that we don't not really know yet.
Yeah, thank you to both of you. There are a few questions in the chat. So one question for Marlene, questions about evaluations of the physical program. What are the most important factors to check? Maybe Esther or Cindy?
But there are in the physical assessment, we have to check at least muscle condition with the test if we don't have the other machines, but at least we have to make some tests to evaluate if patients are sarcopenic or not sarcopenic. And the global assessment, we have to check if there are not major contraindication, as Cindy says, for example, cardiologic contraindication and other comorbidities. I think for us, like as nurse, we can check, and that can be make a special link with patient if we check the motivation and the barriers to physical activity, not to a sport, as Cindy said, to physical activity. With that, I think that we can start to counseling a program. Cindy, if you think that.
Yes. I totally agree. And I think if the question is about how we re-evaluate the patient to know whether we are effective or not, I think that, as you say, it's the same simple test in terms of 6-minute walking test or on grip. We know that they are well correlated with the risk of complications of the treatment, for example. And so that's why our message is keep simple. do it systematically, but keep it simple to be able to do it systematically. I think that's an important message.
Yeah. Okay, thank you. Iga, please.
Thank you. During your presentation, Cindy, you mentioned motivation, and having heard about Radek's story, in his case, motivation was probably one of the most important factor, because he really wanted, and he was also supported. So also this factor is very important. But actually what he did was when he left the hospital, and then what he did was during his stay at home, and his motivation, support from the family, from his friends, etc. But one of his part of the story is swimming. So especially the problem for pancreatic cancer people who are after the surgery and they do not have pancreas, so it's insulin pump. So have you ever had any experience with this kind of problems for the patients, because you probably rather worked with them in the hospital? So what's your opinion about this? Because this is particular for the pancreatic cancer patients.
So you mean about the swimming practice, or
Yeah.
about dealing with the insulin pump?
Both at the same time.
I have a solution actually, because I can disconnect insulin pump, and I can explain it. Look, that this is connection, yeah, but you can disconnect this connection and tape it by special stretch foil around stomach and around sensor on the arm.
Okay.
Stretch foil is the best solution.
Okay, so you've got already a solution, but from
yeah,
the physician story, from the
2 days ago, I swim on the ocean and also in the swimming pool. So it's the perfect solution in last 2 years.
Okay.
Stretch foil for packing something.
Yeah.
Okay.
Thank you, Radek. Cindy, do you want to comment anyway?
I think it shows that activity can be adapted.
Exactly.
To make it
so, if you want it, you just do it. Maybe it's not so simple, but you need to have a really good motivation. Thank you.
Okay, so we have time for one more question from the audience. No other questions?
I would like to ask Radek that just answered to the last question about the insulin pump. I remember from your daily plan that you have dinner at 14 hours, and then you have breakfast at 6 a.m. So do you fast from 14 hours until 6 a.m.?
I can explain it. Now I moved breakfast time to 9 a.m. Yep. But 9 a.m. is the first breakfast. Second breakfast, little toast, for example, or apple, is on 11. 2 p.m. I have dinner, and after this I have a little second dinner at 5 p.m. and about 7 p.m., 8 p.m. I had supper.
Okay, you forgot to include that in the slide. That's nice. Yeah, thank you.
During my trainings, it could be banana or something I prepared at 5 a.m. Of course.
That's good. Yeah. Excellent.
Thank you. So thank you, Radek, for explaining this. And there is a technical questions. If the recording will be accessible, yes, it will be. Porna, was you asking? It will be accessible. Well, not immediately. We need then
now,
to edit. Yes, sorry,
now I
Radek.
am okay.
Yes, okay. Go ahead.
Now I am Luisa. Sorry for interruption. In this time, just now, I am preparing a helpful support book for somebody who has a problem with pancreas or without pancreas. It would be a form of ebook supporting somebody about physical activity, about eating, about insulin pump, all these problems from my history, because I am a tester of solutions. 1 week ago, I had a presentation for diabetologists in our country. How to be supported in diabetic problems without pancreas.
Yeah. That's very good. Thank you, Radek. Yeah. So just to conclude, Porna, the recording will be available, edited, not immediately. We will send you a message when the documents will be available. But yes, you can access it very soon. Yeah. So if no other questions are in the chat, no one else raise the hand. So we can come to the conclusions of the webinar. And before giving the floor to Alfredo, we would like to inform you that Pancreatic Cancer Europe will soon launch a communication campaign on how the importance of physical activities for pancreatic cancer patients. And the communication campaign will aim at launching 5 animated videos on physical activities that are under production and will be available for the general public, both in English and with a subtitle translated in several languages, so that patients in many countries can make use of it. And the videos are based from the booklet that Cindy Noisilette was mentioning, that Pancreatic Cancer Europe published a few years ago. So we are ready to show you the trailer of this campaign. Is very brand new activities that we received from our video makers. So Anna, you can show.
Welcome to PCE's Physical Activity and Pancreatic Cancer Project, designed for pancreatic cancer patients. In 5 short episodes, we will explore how staying active, safely and effectively, can improve physical, mental, and emotional well-being. Join us to discover how physical activity can enhance quality of life at every stage of the journey.
Good.
Yes, so this is the trailer. The 5 videos will be ready soon, but they will be launched and available from September on. So we are very happy of these initiatives because we believe that physical activities is very important for the treatment of pancreatic cancer patients. And we hope that this campaign will support and will make patients more thinking, to start physical activities for their well-being. Okay, then we come to the conclusions. As Alfredo Carrato, you already met him. He's a emeritus professor of medical oncology at Alcalá University, and he is the chairperson of Pancreatic Cancer Europe. Among others, he has served as a director of the Ramon y Cajal Institute for Health, as president of the National Advisory Commissions of Medical Oncology at the Spanish Ministry of Health and Education, as president of the Spanish Society of Cancer Research and the Spanish Federations of Oncology Societies. He has been president of the Spanish Society of Medical Oncology. So, Alfredo, thank you for being with us and to conclude this webinar.
Thank you very much, Luisa. I have enjoyed the meeting very much, and I have learned también also all the speakers have been excellent. First of all, I would like to thank European Pancreatic Club and European Oncology Nursing Society, as well as Pancreatic Cancer Europe, for developing these initiatives that are the best for our patients. And I want to congratulate all our speakers, Fernanda, Afrodita, Radek, with his positive commitment and his advices, and Cindy Nocijet, of course, and Esther Molina, that made the symposium brilliant and understandable for everybody. I think that Luisa made a very important, as well as Lucia, paper here, and I want to thank them also, as well as Priya. The issue is that motivation, it's a mind issue, and it's what needs the patient to face the challenge of the disease. So it's not, as Cindy said, that we are talking about sports. It's to increase activity in the everyday activities, to avoid sedentary ways of living, and to induce patients to be more active and active every day. So we can start with small changes and end with bigger and more intense in duration changes. But this has to be tailor-made for everybody, and we don't have to forget the well-nourished situation that the patient has to be to support also the physical activity, as well as some psychological support if needed. That is important to support the patients on doing what they are thinking, that is a positive return for them. They have to feel that the physical activity helps them, and the empathy that Cindy told, it's important. So it's not just to watch a video, it's to talk face to face to the patient, either the nurse like Esther that made it wonderful, or Cindy, or everybody that is devoted to this, to improve the self-esteem of the patients, to preserve the mental well-being of the patients, to lower the stress that they may have, and to improve also the quality of life, the quality of sleep, the quality of mood, the muscle strength, everything that has to be improved, instead of just have a negative point of view of the situation that has to be lived. So I have to say, from the scientific point of view, and Cindy mentioned that the muscle has to be trained to avoid the problems created by the disease itself and also by the treatment itself. And this is also helping the immune system, because the muscle releases some cytokines, some substances that increase the immunity. They provoke an anti-inflammatory stage and help the cells involved in the immune system, the lymphocytes, to attack the tumor. So the result is that we are helping the patient sometimes more with this than with the adjuvant treatments that are given to the patients and they recur. So this is not chemotherapy, this is not radiation, this is not surgery, this is physical activity. As Esther said, the patient is the only one who can make it. And this results also in a change of the microbial abundance and diversity in the colon, and also enhances immunity. So I have to say that this issue is not a minor thing in the treatment of the patients. So, as I said, adjuvant treatment fails in pancreatic cancer in almost 2/3 of the patients after surgery has been done. But when you start with this physical activity treatment and emotional and well-nourished activities, you have success in a wider percentage of patients. So I think that it's worthwhile to include in the multidisciplinary team an expert in physical activity that can assess each patient how to deal with this item. I want to thank you all for your attendance. I want to thank the three societies for implementing this discussion, and I would like to congratulate you and to wish you the best and maintain your activity on this kind of way of treating patients, that is physical activity, that will be of help, many help, and we have to convince the authorities to put specialists in physical activity in the hospitals, in the outpatient buildings, etc. So because it's needed, and we don't have this facility now. So I want you to thank you very much, to keep ongoing with this activity, and to thank for your support in this important issue. Thank you very much.
Thank you, Alfredo. So we close now the webinar, and just to remind you that the video recording and a very short report of this webinar will be available very soon. You will receive an email when the documents will be available, so that you connect to our website and check the report. So thank you very much, and we keep in touch. Bye. Bye-bye.
Thank you.
Thank you. Bye-bye.